My name is Dr. Patricia Gerbarg. I'm a psychiatrist. I've been in private practice for over 30 years. I did my training in Boston at Harvard Medical School, and I am currently an assistant clinical professor in psychiatry at New York Medical College. I specialize in integrative psychiatry, which is combining the best of both standard treatments and complementary alternative treatments in order to give each person the best possible outcome. I've co-authored a number of books with my husband, Dr. Richard Brown. The first of these is The Rhodiola Revolution, which describes a very powerful ancient medicinal herb. The second is called How to Use Herbs, Nutrients, and Yoga in Mental Health Care, and that covers every aspect of mental health, from cognitive function to anxiety, depression, post-traumatic stress, addictions, and many others. The third book is Non-Drug Treatments for Attention Deficit Disorder, and the most recent one is called The Healing Power of the Breath. That's a book and CD set that will teach how to do specific breath practices to balance the stress response system and relieve anxiety, depression, insomnia, and stress. Many people begin to notice changes in their memory and their cognitive functions. The cognitive functions refer to all of the thinking kinds of things that we have to do. And it's natural to have some decline as we age. The normal decline in memory and cognitive functions is called age-related cognitive decline. And when people start to become forgetful, everybody panics and worries that they have Alzheimer's disease or something else. Most of the time, it's really part of the natural aging process. And there are some things that we can do in order to slow down that decline and sometimes even to reverse it. The brain needs a lot of nutrition because it burns a great deal of energy. Our bodies, our cells, have a tremendous capacity to repair themselves, but they need energy to do that. And as we get older, our energy tends to go down. And if we can't maintain the cellular repair systems, then what happens is cumulative damage occurs that isn't getting repaired. And that is what leads to the progression of many disorders, including cognitive and memory decline, when there's progressive damage occurring slowly, little by little every day, and yet the cellular repair systems can't keep up with it. So there are things that we can do about that. Number one is a healthy diet, because we need those nutrients in order to maintain the health of all the brain cells. And we know that as we age, we may not be digesting our food quite as well. We may not be extracting, even if you have a good diet, you may not be extracting all of the nutrients that you need. There are certain nutrients that are especially important for the function of the brain cells, and those are the B vitamins, especially B12, but also B6 and some of the others, folate or folic acid, omega-3 fatty acids. These are essential for the functioning of the brain cells, and so usually as patients age, I recommend that they take good omega-3 fatty acids, at least 1,000 milligrams once or twice a day. And that should be a combination of EPA and DHA. So look at the bottle and make sure it's got both EPA and DHA in it. Now, some people have problem taking fish oils that may bother their digestion, or they may feel that they're burping fish oil all day long. It's very unpleasant. If that happens to you, you will need to get a more refined form of fish oil. There are some that have no flavor to them and that are much more easily digested. They're a little more expensive, and there are a number of companies that produce those. In our book, How to Use Herbs, Nutrients, and Yoga in Mental Health Care, we have charts and we have lists of all of the supplements and of really high quality brands, and we also tell you where to find them and how to order them. So nutrition, that's essential. Also, the absorption of B12 tends to decline with age. So I have my patients take a B12 sublingual tablet. They're called B12 dots, and you just put them under your tongue and they're absorbed directly into the small blood vessels. So you don't have to worry about whether you're able to digest and absorb it through your stomach or not. And that's also important. Now, in addition to essential nutrients like these vitamins, and there are many other vitamins that are important too, but if you get a one-a-day A to Z type vitamin, you're likely to be able to cover all the bases. In addition to these kinds of nutrients, there are certain herbs that can help the brain to function better and to reduce the inflammation due to free radical damage. One in particular that not too many people know about, but I think a lot of people are going to hear more about, is called rhodiola rosea. It's now possible to buy rhodiola root extract in a health food store or to order it online. It's even being cultivated now in Canada, and it's just started to be cultivated in Alaska. So we'll have some rhodiola rosea grown in the good old USA probably in the next year or two, and that's a very exciting prospect. Now, how does it work? Well, you have to understand that unlike prescription medications, which are designed to do one thing, the roots of this herb have many different medicinal compounds that do different things. So, it has dozens of antioxidants in the roots. That has been proven. And those antioxidants help to protect all the cells of the body, including the brain cells, from free radical damage. So that alone is a benefit. We use rhodiola rosea a lot in our practice. In fact, we take it ourselves. We give it to our friends and family because it's very low in side effects and it's good for what ails you. I don't know how else to say it. It's very good for energy. So if a person is having problems with fatigue, it will naturally increase the energy. It's not like a stimulant like an amphetamine. It doesn't cause a high and a crash. It doesn't cause addiction or anything. It simply increases your cell's ability to produce more energy for a longer period of time in a more natural way. So for problems of aging, and I include in that cognitive and memory decline, rhodiola rosea can be very helpful because it not only protects the cells with the antioxidant protection, but it also increases the ability of the cells to produce more energy, to repair themselves, and to function better as a network. And that's what we need to do in order to have better memory and cognitive function. So try to educate your healthcare providers about these things by first educating yourself, reading our books or someone else's books, although of course I think ours are best, but reading about it, get information, and then when you know enough to discuss it, do so with your doctor.